My name is Brad Greenwood. I'm an associate professor at the University of Minnesota's Carlson School of Management.
What is the most exciting thing you're working on?
Dead Ladies Project is probably the coolest thing that we're working on right now. Look at how gender overlap influences cardiac outcomes. So if I share gender with my physician, I'm a man, he's a man. I'm a woman, she's a woman. How that influences the likelihood of me surviving a heart attack. What we find is that gender overlap has a pretty significant impact, and it's entirely driven by the fact that male physicians are far more likely to have female patients that pass. So they're significantly less qualified at treating female patients. And it's actually attenuated on some pretty interesting circumstances. So if a female patient presents with chest pain, if she presents like a man, the effect seems to go away. If the male physician practices with more female doctors, or if he's seen more female patients in the past, the effect begins to attenuate. But it's still pretty striking that male doctors can't treat the female patients. It's no good.
Why did you come to CHITA?
I've been coming to White/CHITA for since it was a young conference back in the 40s. Really, it was. I'm not just kidding. It wasn't back in the 40s. No. So I think this is the 7th or 8th year. So Ritu is my advisor, and I started coming when I was but a young doctoral student, bright-eyed and bushy-tailed and idealistic. And it's cool because like every year the conference kind of evolves of what exactly people are dealing with, what they're talking about, and the research just keeps getting better and you're getting in more and more disciplines of so these very disparate academic domains. And it's cool to see different people's perspectives on kind of the same general idea.
Okay. What do you think are the biggest or most fascinating research questions in the CHITA space?
In the CHITA space, I think the things that create implicit bias against certain groups are the ones that are really interesting. Because I think we live in this like halcyon era of healthcare. Yet there are systemic disparities in group outcomes based on race, gender, socioeconomic status, which are completely nonsensical. Like the fact that these things still happen, I think is really, it's one, troubling, and two, fascinating area for kind of future work and how the machines, our robot overlords, can begin to solve these problems.